everyone, welcome back to my YouTube channel. In this video we will talk about ileostomy or colostomy. There are artificial openings in the bowel which divert the feces and floaters to the exterior where they can be collected into a bag. Ileostomy. What are the indications for the ileostomy? Ileostomy can be temporary or permanent. The temporary ileostomy is performed defunction the gut distal to stoma. It is performed in the case of severe inflammation or obstructive inoperable tumor of the gut distal to stoma. Ileostomy is closed after the initial pathology is dealt with, usually after 6 to 8 weeks. Permanent ileostomy is performed in the cases where total colon including the rectum is resected, as in the case of ulcerative colitis and familial adenomatous polyposis, etc. Why temporary ileostomy is performed? Temporary ileostomy is performed to protect the distal anastomosis so that feces do not pass through the anastomotic side, and it should be healed. Is it necessary to perform temporary ileostomy proximal to anastomosis in every case? No, it is not necessary to perform ileostomy proximal to every anastomosis. It is performed only when there is a risk of the leakage of anastomosis, severe sepsis, anemia, hemodynamic instability of the patient, severe inflammation at anastomotic site, typhoid perforation. In all other conditions, anastomosis can be performed without proximal diversion ileostomy. Temporary ileostomy is closed usually after 6 to 8 weeks. Types. There are 3 types of ileostomy: loop ileostomy, double barrel ileostomy, and end ileostomy. Loop ileostomy. Loop ileostomy. In the loop ileostomy, a loop of the ileum is brought out through a hole in the abdomen, and this loop is fixed with the anterior abdominal wall. A hole is made in the external portion of the loop to drain feces and floaters. In double barrel ileostomy, the diseased segment of the bowel is resected and both ends are brought out through a hole in the abdominal wall. End ileostomy. End ileostomy is usually performed in the case where it is ended permanently. In the end ileostomy, total protolectomy is performed and end of the ileum is brought out as stoma. Colostomy indications and type of colostomy, and they are same as in the case of ileostomy. Permanent sigmoid colostomy is needed after the abdominal perineal resection APR, and temporary colostomy is performed in the rectal perforation, high and recurrent fistula in anastomosis of rectum and Hirschsprung disease, etc. Now we will talk about the complications. Prolapse is a complication of ileostomy, and peristomal hernia, loop of the bowel can herniate along the side of stoma, bleeding, spillage of the content feces into the wound. How to choose a site of stoma? The site of stoma is very important and should be discussed with the patient preoperatively. In the case of ileostomy, the usual site is right iliac fossa, but the stoma should be 6 cm above and medial to bone prominence so that the external bag can be applied easily. Sigmoid colostomy is performed in the left iliac fossa, and transverse colostomy is performed in the right hypochondrium. Difference between ileostomy and colostomy. Ileostomy is usually sited in the right iliac fossa, while colostomy is sited in the left iliac fossa. Content of ileostomy are watery and semi-solid where they are formed faced in colostomy. Skin excoriation occur more in ileostomy, while performing closure of ileostomy, no special gut perforation is needed. Why perforation is necessary before colostomy closure? If you have any query, can ask me in comment section. Thank you.